Hello everyone, welcome back to my channel. Today we will talk about the anatomy of lungs. In this video we will be talking about the gross anatomy of lungs, surfaces and borders of lungs, hilum and root of lungs, fissures and lobes, bronchopulmonary segments, blood supply, nerve supply, lymphatics. So this is all we are going to study in this video. So yeah, let's get started. So lungs are pair of respiratory organs that is situated in thoracic cavity. It has pinkish brown color in the young age, but as the age grows in adult it gets mottled black due to deposition of carbon particles. So it is conical in shape. It weighs about 650 to 800 gram, of which 40 to 50% is blood. And as you can see here, this is the apex of, so we will talk about the surfaces. It has three surfaces: costal, medial and diaphragmatic. It has lobes. Right lung have three lobes, upper, middle and lower, and left lung has two lobes, upper and lower, which is separated by the oblique fissure. Now as you can see here, this is the bronchioles, this is alveoli, trachea. Understanding the upper respiratory tract, it includes the nasal cavity, nose, pharynx which is throat, and larynx which is voice box. Now lower respiratory tract is the trachea, lungs, bronchi, bronchioles, alveoli. All these are included as lower respiratory tract. Normal respiratory tract is 12 to 16 breath per minute. It has innervation of subclavian artery. If we talk about the borders of the lungs, then the interior border has costomediastinal line of pleura. Left lung is deeply notched. Left lung, where there it is deeply notched at the fifth costal cartilage to form the lingula. Lingula, which is the cardiac notch. As you can see here in this image, it is deeply grooved at the fifth costal cartilage. Now the inferior border, it separates the base from the costal surface. The posterior border, it is thick and ill-defined. It fits into deep paravertebral gutter of the C7 to T10 vertebral level. Surfaces of the lungs, then costal surface and medial surface. It has two surfaces. If we talk about the costal surface, then it is the posterior and vertebral part, and medial surface is the anterior or the mediastinal part. And right lung having three lobes and left lung having two lobes. Now as you can see here in the image, this is the relations of the right and left lung with the trachea, cervical part, brachycephalic vein, aortic arc, superior lobe, pulmonary artery and pulmonary veins, superior vena cava, brachycephalic vein. These are all the relations of the right and the left lung. Root and hilum. Understanding this, what is the root and hilum of the lung? Understanding what is the root of the lung, the bronchi and the pulmonary vessels that extends from trachea and heart is collectively forming the root of the lung, and the part of the medial surface where these structures, that is bronchi and pulmonary vessels, enter the lungs is known as hilum of the lung. So collectively these are known as the root, and where they enter on the medial surface is called the hilum of the lung. It contains as you can see this pulmonary ligament. So the hilum of the lung is the entrance and the root is the contents, as in an easy language to understand. Then root contains eparterial, hyparterial bronchus, one pulmonary artery, two pulmonary artery, bronchial artery on the right side, and the one pulmonary vein on the left side. So this is the difference. Now understanding the oblique fissure, that starts at T3 spinal level. It descends and ends at 6 costal cartilages. The trachea, understanding what is trachea, then this is the bifurcation At T5, continuation of the larynx, it has incomplete rings of hyaline cartilage and the length is about 10 to 12 centimeter. And in lower end, it is continuous with the right and left main bronchus bifurcation. Then thyroid and brachial artery are the innervations, and nerve supply is vagus, and recurrent laryngeal nerve is the nerve supply of the trachea. So this bifurcation point is known as the carina of the trachea. The carina is a landmark during the bronchoscopy. It is seen internally with the elevated ridge at the bifurcation, which is known as the carina of the trachea. So the bronchi is divided into bronchioles in apical, posterior. It is fixed and it is bifurcated like this only, that the left lung is having this much of bifurcations. The upper portion is having apical, posterior and anterior part, unlike as you can see this bifurcations clearly visible. This is same, and but instead of superior and inferior on there is lateral and medial on the right side. Now we will talk about the blood supply. Then lungs have two types of blood supply, that is circulation, bronchial circulation and the pulmonary circulation. If we talk about the bronchial circulation, then the trachea and esophagus, which is the main stem bronchi and pulmonary vessels into the lung, as well as visceral pleura, are supplied by the bronchial systemic circulation. And the bronchial circulation has enormous growth, so it is good for in case of long-standing inflammatory and proliferative disorders. Now pulmonary circulation is at the hilum in loose connective tissue sheath. It is of type extraalveolar and alveolar. If we talk about the nerve supply, then anterior and posterior pulmonary plexus, parasympathetic fibers of vagus nerve and sympathetic fibers of fifth thoracic ganglion. Now if we talk about development of lungs, then entire development process of the lung is during the 4th week, when the respiratory diverticulum is formed and it descends, separates from the esophagus as TE fistula. Long bud of this descent is converted into trachea, and at 5th week right and left main bronchi. At 6th week 17th generation of some divisions have formed, and rest forms during postnatal period. Now if we talk about the maturation period, then the pseudo-glandular canaliculi and terminal sac alveolar all are formed at the certain weeks, which is written over here, that pseudo-glandular type is formed during 5 to 16 weeks and so on. If we talk about the lymphatics, where its drainage, as you can see here clearly in the image, there is paratracheal node, subclavian trunk. Thank you. Do like, share, subscribe for more such videos.